Our next speaker takes the human core into the world of data. The question is no longer whether a seafarer is fit for duty, but how data, artificial intelligence, can keep them healthy as well. Please welcome Dr. Laura Benzonana, Chief Operating Officer and Global Ambassador at Health for Crew.
Thank you, and thank you for the invitation, and congratulations on a great conference. So as it was said, I'm Laura, and I'll try and keep this brief because I know you all want to go to your coffee break. So I want to talk to you about the certificate that says fit for duty. Every seafarer in the fleet will carry one, but that's not the whole story. It's a snapshot. It's what happens at the clinic that very morning. So, let me start with the cost of a single medical case, because this bill has two halves. The first half is the one that's tracked, and often in the shipping industry, as we all know, it's inflated. It's the one we can see. So, it's evacuation and treatment, and an international case can reach tens of thousands of dollars. Then we have repatriation, replacement crew being flown out, and all of the logistics and agency fees around this. And of course, the medical costs, which, as we know, are growing and every year by approximately 10%. Now, there's also the hidden cost, the one that's off the books, and it never reaches our report. It's the lost work time, not only of the seafarer that falls ill, but all of his colleagues who have to help with the work around it. It's the downtime and the exposure to your charters. It's the mark on your P&I record and your premiums. And finally, it's the reputation, your reputation, and the retention of your crew. So this is the hidden half that often compounds and isn't seen. So, health costs more than we think. And these are not just data that I'm bringing out. These come from actual P&I reports. So in 2025, GUARD brought out their P&I claims reports, and 1/3 of all the claims that they paid were related to the human element. 60% of those were around illness, not accidents, illness. So conditions that can build quietly, hypertension, obesity, diabetes. In fact, 20% of those at least could have been avoided with preventative data-driven healthcare. This is the gap between what health actually costs and what it really should cost. But where does the clinical risk lie? In a peer-reviewed meta-analysis of 21 different studies of approximately 146,000 seafarers, we know that about 45% had hypertension, 61% were either overweight or obese, and 13% were diabetic. Approximately 60% of all seafarer deaths are heart-related deaths. So half of the seafarers we send to sea are already at cardiovascular risk at day one. And the bigger bill is paid in lives and not dollars. The GUARD crew claims report showed a 25% increase in crew death claims 3 years post-COVID versus 3 years before. And the causes of these fatalities in 2024, mostly illness. Suicide even it was over the amount of injury deaths as well. So the next death claim isn't a stranger, it's the warning sign that was already on that fit for duty permit that we received. So why was nobody looking? Not because the data was missing, but because it was scattered. We have the pre-employment medical examinations, which will give us the detailed clinical baseline of every seafarer at hire. Telemedicine will build a case history across the contract. What is being prescribed at sea will also show us what kind of medications these seafarers are taking. The mental health issues, again, the signs are there and need to be connected. Finally, the late signal, what we pay in P&I claims. There's a study that was performed in 2013 that showed that 168 million could have been saved if these data sources simply talk to each other, not be in 5 different silos. So, what happens when you connect all of this together? That's the difference between proactive and reactive medicine. For most of the industry today, honestly, nothing happens with the data. Most of them live in the reactive column. The office hears about a case when it's already urgent, already expensive. Each case handled is then forgotten. We don't learn from them, and the master is making the call without data behind it. The proactive column is what we can change, how we can work the data properly, and the risk can become visible before it actually escalates. The conditionally fit seafarers can be monitored while on board, and the trends can tell companies where to act with targeted approaches. The data already exists, we just need to connect it. So, everyone is talking about AI, so here is how we use AI. We use AI in order to digitize, aggregate, and collect the data from seafarers to make it into a form that can actually predict different trends on different fleets. It allows us to do the risk prediction and therefore targeted approaches. But what I want to mention and really emphasize here, our principle is AI first, physician last. Everything gets checked by an actual human doctor. Doctors that work for us, for Health for Crew, that have been chosen, that have been trained in the field of maritime medicine. So what do we actually do? We have 4 different pillars in our Health for Crew service. We start with preventative healthcare, digitizing all of the pre-employment medical examinations and giving a second opinion in each and every one of them. Therefore, risk profiling the fleets that we support. Of course, emergency healthcare, 24/7, 365 telemedicine, where we do not separate mental health from physical health. These are not 2 separate silos. These are interconnected things. Mental health can cause psychosomatic symptoms, and actual physical health symptoms, such as obesity, can cause mental health problems. Of course, we do full case management from the first call up to recovery. Now, we do take all of this data and we compile it into fleet insights to be able to support the officers with whatever reporting they may need, from ESG reporting to lost time incident frequencies to trends analysis. Finally, all this data creates targeted wellness initiatives, whether they are training courses for seafarers, posters for the vessel, or one-to-one calls with seafarers that are at high risk. This is not 5 separate vendors. This is all stitched together in one team and one record. All of this is done with the help of our advanced maritime infrastructure. We have a platform that we have developed that is clinically grade and built over years of research and development, and in collaboration with in-house doctors in one of the biggest shipping companies in Greece. It is, the data sits on EU servers, fully GDPR compliant, and it is very important because in shipping you don't need a startup version of a hospital record, you need the production version. The one where the data can sit, live, and therefore allow us to aggregate it and structure it properly. And what does that look like? Well, let's look at what the obesity burden in seafarers looks like. This data comes from our own cohort of 1,073 seafarers screened by Health for Crew. What we saw is that 65% of seafarers screened are, again, either overweight or obese. 65%. Only 34% of seafarers were in the normal weight. Now, if you remember earlier, I told you that cardiovascular risk and heart disease is the #1 driver of seafarer deaths. Obesity affects issues such as hypertension, cholesterol, musculoskeletal issues, all linked with cardiovascular problems. So this isn't abstract industry data. This is actual crews measured today. As we said, by having the data, and then we can segregate it, because we need to do targeted approaches. So we can break it down by age and see how obesity changes throughout the career of a seafarer. We can't have the same targeted approach for a captain and a rating. As you can see, as age increases, so does the level of overweight and obesity. We can also segment it by country, and the differences here are striking. Different money pools can carry very different risks. In our cohort, the Greek seafarers carry the heaviest obesity burden, more than double the average across the data set. We don't want to stigmatize different people and different cultures. We want to target the wellness initiative to really reach the people it needs to reach. A single global wellness campaign is just a blunt instrument. With this, you put the right program in front of the right people and measure whether it worked. Apart from looking at the data and try and prevent illness, we also deal with whatever happens on board. And I'd like to close this argument with a real case that we dealt with. This was a seafarer that developed an infected wound on his leg, most likely an insect bite. This would normally require, if he was at shore, intravenous antibiotics and surgical cleaning. The vessel was at anchor off of Poland, but this embarkation was really complex, and it would be reaching Russia in the next 3 days. We started looking at this case, and our medical team gave antibiotics and instructions to the captain, who started, through remote daily calls, doing the debridement of the wound himself. By day 5, the seafarer never left the vessel because he started feeling better. We had already gotten a quote for a hospital in Russia, which would have been around $9,000, excuse me. But he never got off the vessel. We closed the case through daily video calls with the seafarer. What's interesting, though, is that the next thing that happened really does make it evident that this was an insect bite. 3 months later, on the same vessel, the vessel was in Brazil. They were at the port, and they had a similar incident. They neglected to call the medical helpline. Since they were at port, the seafarer went to hospital. $35,000 later, we were informed. And this is a very real case showing how being there for the seafarer can really change a single case. We can't replace the crew that we have, and then, as you all know, there is a huge shortage in the age that we need most. And these are the ones that are the most dissatisfied. These are the ones that are asking for the support that is needed. So we need to change something, and this is where we come in. The crew welfare is not a cost line. It is a retention strategy. I'll be around all afternoon, so feel free to come by and ask me any questions. I'd be more than happy to talk to you. Thank you very much.
Thank you, Laura, for a very interesting and eye-opening presentation. After listening to it, it seems like the advantage of looking at this topic from preventative rather than reactive is there. How hard is it actually to convince the sort of industry or the ship owners that the value is there?
Very hard. I'm not going to lie, we are in a very, very traditional industry. There are the people that think proactively and that have more of an open mind, and it's usually the companies that have younger people in management. But I think the data speaks for itself. So the more data we accumulate, the more they see the value in actual dollars, the more people will understand it. It's important to start talking about it the same way we talk about alternative fuels. This conversation is way too late. Should have happened ages ago. The more we talk about it, the more people will understand. It's all about educating the market.
Yes, I think it's important to understand that usually you see the 30,000 euro bill or dollar bill and think it's inevitable, but actually there are ways to do it, and once to kind of, if you measure it, then that can lead to a way that there's actually cost savings behind this. Thank you.
And ways that don't put the seafarer in jeopardy, and ways that don't make the seafarer want to get off a vessel, because as everyone in this room knows, is if a seafarer asks to go and see the doctor at port, they can. So ways where the seafarer feels trusted and confident to continue his work without having to go to the doctor at shore. Thank you.